Good morning, ladies and gentlemen, distinguished guests and delegates of Ctpdcon era 2024, the second virtual international conference on educational reforms and advancements, organized by the Council for Teacher Professional Development in collaboration with its organizing partners, K.R. Mangalam University, Gurugram, Haryana, India, Galgotias University, Greater Noida, Uttar Pradesh, India, Saraswati College of Professional Studies, Ghaziabad, Uttar Pradesh, India, Satyug Darshan Institute of Education and Research, Faridabad, Haryana, India, DAB PG College, Dehradun, Uttarakhand, India, Institute of Teacher Education, Faridabad, Haryana, India, Thakur Shamnarayan College of Education and Research, Mumbai, Maharashtra, India, Sanjay Teachers Training College, Jaipur, Rajasthan, India, Social Development and Research Foundation, India, Council for Teacher Education Foundation, India. I, Dr. Rachna Sharma, Associate Professor at KIT College of Education, Gurugram, feel honored to be the co-convener for this educative technical session of Ctpdcon era 2024, Track 4.3, Community Engagement, Partnerships, Research and Innovation for Inclusive and Equitable Education. And it is my pleasure to introduce the moderator for this technical session, Dr. Shweta Tyagi. She is Associate Professor at IPEM Group of Institutions, Ghaziabad, Uttar Pradesh, India. Now it's over to you, Shweta ma'am.
Thank you so much, Rachna ma'am. I am Dr. Shweta Tyagi, and it's a great honor for me to be the moderator for this educative technical session of Ctpdcon era 2024 track 4.3 on the theme Equitable Quality Education for lifelong learners, a commitment to inclusion. The sub-theme of this technical session 4.3 is community engagement, partnership, research and innovation for inclusive and equitable education. We have eminent speakers and paper presenters who shall be sharing their expertise and insight in this field. I'm delighted to extend a warm welcome to our esteemed chair, Professor Dr. Deepa Sikand Kautz ma'am, Dean, Faculty of Education, Guru Nanak Dev University, Amritsar, Punjab, India, and co-chair Dr. Sunita Devi, Counseling and Rehabilitation Psychologist and Lecturer, Department of Rehabilitation, Intellectual Disabilities, Sikandrabad, Telangana, India, for gracing us with the presence and leading this significant session at Ctpdcon era 2024. I extend a warm welcome to convener of the track, Professor Dr. Tanya Gupta, Dean School of Education, Dean School of Humanities, Director IQAC, K.R. Mangalam University, Gurgaon, Haryana, India. I also express my gratitude to the co-conveners of the track 4, Dr. Rachna Sharma, Associate Professor, KIT College of Education, Gurgaon, Haryana, India, and Dr. Pravesh Lata, Associate Professor and HOD, Department of Education, School of Humanities and Social Science, GD Goenka University, Gurgaon, Haryana, India. I feel honored to introduce to the convener of the track 4, Professor Dr. Tanya Gupta, Secretary General, CTPD, Program Director, Inclusive Education Circle, Program Director, Circle of Innovative Pedagogy and Lifelong Learners. May I request and invite you, ma'am, to please present an overview of the plenary session 4.3. Over to you, ma'am.
Good morning. Thank you, Dr. Shweta, ma'am. Once again, good morning to everyone. At the outset, on behalf of the organizing committee of Ctpdcon era 2024, let me welcome Professor Dr. Deepa Sikand Kautz, Dean, Faculty of Education, Professor, Department of Education, Guru Nanak Dev University, Amritsar, who's our esteemed chair. Welcome, ma'am. And Dr. Sunita Devi, Counseling and Rehabilitation Psychologist and Lecturer, Department of Rehabilitation Psychology, National Institute for the Empowerment of Persons with Intellectual Disabilities, Secunderabad, Telangana, who is our esteemed co-chair of Track 3. I also welcome our paper presenters and the participants of this session. It is both a privilege and an honor for me to present before you an overview of this session of the CTPDcon Era 2024, the second international e-conference that is being organized by the Council for Teachers' Professional Development in collaboration with several higher education institutions in India. Dear all, the track 4, as you know, is on equitable quality education for lifelong learners, a commitment to inclusion. So this track is it embodies one of the most critical challenges and aspirations of our times. That is, we ensure that education is not only accessible, but it is inclusive, it is equitable, and it is transformative. So our focus as educators is not just to provide education, but also to shape an educational ecosystem where our learners, irrespective of their backgrounds, their identity, or their circumstances, can continue to learn throughout their lives. It is my privilege that in track 4.3, which is on community engagement, partnerships, research, and innovation for inclusive and equitable education, we have a number of paper presenters who I'm sure are going to, we have in fact 8 paper presenters in this session. And we really hope that they will explore topics like how we can build strong partnerships and what is the role of community engagement, how can innovative research support in diverse learners and their needs, and what is the role of mental health support as well as maybe psychotherapeutic interventions, how all these would help to foster an educational environment where no learner is left behind. So with this hope, we are all looking forward to build a mutual perspective, engage with each other, and through this technical session, the discussions that we have here, we look forward that we can build collaborative insights through the presentations that are coming forth and the address of the esteemed chair and the co-chair. I'm sure we will be much better informed and we will take back things which we can, we can work at our own spaces and make a difference in the lives of our learners. So with this, my best wishes for this track.
Thank you so much, ma'am. Thank you very much, ma'am. Now it's my honor to introduce our esteemed chair, Professor Dr. Sikan, ma'am. Dr. Deepa Sikan Kot is a professor.
Can we change the slide here?
Yes, ma'am.
No
I'm
problem.
trying, but
no hurry.
Just.
You need some help from us? Rachna,
Actually, change nahi ho rahi.
We help out, please. Ma'am, stop the screen.
Ma'am, you just stop sharing the screen.
We'll help you
Okay.
out. No issues. Apologies, ma'am, for the.
I'm sharing again, ma'am. Sorry for the apology.
No problem, ma'am. Please continue.
Yes.
You have to just click the slide number in it.
Yes, yes, yes. Is it visible?
Yeah, now is it? Great.
Thank you, ma'am. Thank
Good
you.
to go.
It's my honor to introduce our esteemed chair, Professor Dr. Deepa Sikand Kaur, ma'am. Dr. Kaur, ma'am, is a professor and dean, Faculty of Education, Guru Nanak Dev University, Amritsar. Her teaching specializations are research methodology, educational psychology, courseware design, educational measurement and evaluation, guidance and counseling. Her research focuses on behavior development among adolescents and early childhood stage with special focus on emotional coaching and emotional intelligence. She has mentored 10 doctoral research, 105 master dissertations and has authored over 80 research papers and 24 book chapters in the field of teacher education. She has presented paper and participated in more than 130 conferences and workshops at international and national levels. She coordinated one major UGC-sponsored research project on teacher stress and creative management of teacher education institutions. She is visited member of NCTE, NEC, and UGC assessment in various capacities. She has developed and launched nearly 10 courses at the Department of Education, GNDU, in the light of NEP 2020. Ma'am, with your guidance, we are confident that this session will be a resounding success, leaving a lasting impact on all participants. May I invite Professor Dr. Deepa Sikankot, ma'am, to deliver her address. Ma'am, please.
Thank you, Dr. Shweta. Good morning to one and all present on this platform of CTPT e-conference. I'm really delighted to see how Professor Tanya Gupta is working hard to bring all the higher education institutions together. And the team of CTPD is really doing a remarkable job in the field of education. I didn't know this is the second conference. I was thinking that this is the first conference, but the brochure said it is the second conference. Though I'm a life member, but I'm very sorry. I didn't realize that it is second conference. It's really always, I always say one thing: the people who are doing in the field of education, they are working for the quality concerns. That is why they are working. Now, the title says that it is equitable quality education for lifelong learning. Now, when we organize such type of conferences, workshops, talks, we really look forward for our quality concerns. A small thing, just now, Dr. Shweta was not able to pick up the slide, but Professor Tanya made it a point that yes, we should pick up the right slide and it should be displayed. I mean, that is what is required in practicing the quality things. We may take a bit more time. This is what inclusion is. We have been talking about inclusion, inclusive theories, and we have talking about Salamanca statements of 94. And still we are working on the lines of inclusion. In 94, the Salamanca statement which came, it said we should have inclusion all around in our schools. And even after 30 years, we are still working on the inclusion. Why? Because the practices and the concerns we are not following. So today, a bit of example was seen on this screen, and this is what is required. That we should ensure what we look for the outcome. We should ensure it happens. Be it a international conference platform, be it a national conference platform, or a school or a classroom. So Quality means whatever outcome we have framed, we are following that outcome. One thing. Then equitable means none is left behind. Very beautifully, Professor Dr. Rachna elaborated that with whom we are collaborating for this in this conference. So everybody was represented through her verbal words. She named all the organizations equitable. No, means everybody has got a chance as per their capabilities, as per their potentials. Equitable and lifelong, meaning thereby we should develop that attitude and concern in the learners that they can carry it through their lives. They are able to enjoy their own concerns, their own works. That is what lifelong learning is. The concern is that every learner has got some objective, some goal, some aim for his life, and he works for that, or she works for that. That is what lifelong learning is. Yesterday, Professor Kovac from University of Calgary, I visited his department and his university, and we have met also there. He's a wonderful researcher, I would say. He could analyze the things, he could analyze the data from different countries and put together. He was showing us that though we are talking about equitable, sustainable, inclusion, but there is so much of variation. Now, should we call for those variations, or should we have equitable concerns for the development? The outcome should be development of the learners with respect to life goals. That is more important. As well, as far as our country is concerned, our country is still coming in developing countries. Am I right? It is still coming in developing countries. But when I went to so many universities of developed countries, I realized that they are having inclusive environments. And their curriculum designs, their teaching pedagogies, their learning pedagogies, their learning environments, their teaching learning spaces, they all are interconnected in such a manner that all get their share. All get their share. This is what inclusiveness is. So they are running every system in inclusive environment. It's not only their education system. It is their other systems also which are running inclusive environment. In our country, the biggest issue comes with our infrastructure. So when we talk of collaborations, let's collaborate with those organizations, with those institutions who can enrich our infrastructure. That is the biggest obstacle, barrier for making our system inclusive. Let's collaborate with them. Let's collaborate for research proposals, wherein lots of resources required, which is provided by the resourceful organization, and we can use our expertise of strategies, our theories, our experiences, our research insights in those projects. Let's be one academic, the body, one academic and the other resource body. Let's have collaborations with them for research purposes even. Inclusion, for inclusion, I believe today our presenters, paper presenters will give us their experiences, their experiments they have conducted in the fields, and they will give us solutions to overcome the obstacles which are which are coming in uh, our path of inclusion, especially when we talk of NEP 2020, with reference to NEP 2020. Wonderful concern of NEP 2020 is holistic development of the learners. And another concern is yesterday, one of your keynote speaker was addressing to Indian knowledge system. That was a very, very, I mean, wonderful gesture to our knowledge system. She said, we don't have Singapore knowledge system, but you have Indian knowledge system. So NEP 2020 has brought it to the limelight that there is Indian knowledge system, and we are also working on the curriculum revamping with respect to Indian knowledge system. Soon it will be out for all the institutions. It is a concern of Ministry of Education, basically. Now, in Indian knowledge system, if we look at the Indian philosophy, if we look at the Indian ancient literature, the lives, the stories, the scriptures, we find it was already inclusive. Shikhandi, it's a wonderful example. We talk today, we have started including so many genders now. We had it. We had wonderful inclusive system. But with passage of time and with so many invasions, it went. I don't know it went where. So that time also there were, teachers were not there who were given special training to handle these special cases, but they were teachers. They had outcomes in their minds. They were learners. The learners were told about their duties. The teachers were told about their duties. So their duty was that all should sit together, study together, and according to their potentials, the works were divided. This is what inclusion is. Let everybody has a choice. If we say we should have choice-based curriculum, we should have credit-based curriculum, what is the outcome? What is the requisite outcome which we want? Let us focus on that first. Then move towards choice-based curriculum. And then we have to see its repercussions on our resources also. Now, these repercussions help us to understand how to collaborate, where to collaborate, what to collaborate. So I believe today our presenters will help us to know all these questions, how we are going to have inclusion, what barriers we are finding in our inclusive settings, what National Education Policy 2020 requires from us, and how we can go about it, what small experiments we have undertaken in our fields, on our places, in our classrooms, in our institutions, and will come with some strong recommendations with respect to inclusion and quality education. Thank you so much.
Thank you so much, ma'am. Your insight have left an indelible mark on all of us, ma'am. Now I feel privileged to introduce our esteemed co-chair, Dr. Sunita Devi ma'am. Just give me 2 minutes for sharing the slides. Presently, ma'am is working as a lecturer in rehabilitation psychology at National Institute for the Empowerment for Persons with Disability with Intellectual Disability. She has more than 20 years of teaching experiences in the field of academic and industry. She worked as a senior consultant at Manodarpan Cell, Department of Educational Psychology and Foundation of Education, NCRT, New Delhi. She was the resource person of different public and private sectors like Bureau of Police Research and Development, Ministry of Home Affairs, New Delhi. She has featured in different programs like Exam Fever, Delhi Aaj Tak Channel, Exam Stress and Handling Exam studios on DD News, talk show on IGNU, Gyanvahini 105.6 FM radio. She worked with NTPC, Hero, Maruti and Reliance, etc. She has conducted a lot of online session as an expert. She has been awarded by Bharat Gaurav Puraskar, Certificate of Excellency for Outstanding Achievement and Remarkable Distribution. Now, this is the time of paper presentation. With the permission of our chair and co-chair, we now commence with the paper presentations. We are pleased to announce that during the validatory session, the Best Paper Presentation Award will be announced. The evaluation criteria for the award include content quality, clarity of presentation, effective use of visual aids, and time management. We kindly request the session chair and co-chair to submit the name of the best paper presentation from their session to be the track convener for final consideration. Ma'am, kindly allow me to reiterate and request the presenters to be concise and adhere to the time limit of 5 to 7 minutes for your paper presentation. Without further ado, I would like to invite Chair Professor Dr. Deepa Sikankot and Co-Chair Dr. Sunita Devi to officially commence this session. Ma'am, we look forward to your valuable contribution throughout the session and the dynamic synergy for you will create, ma'am. Thank you, ma'am. Now, I would like to invite Miss Yashika Yadav and Dr. Manju Until from School of Humanities, K.R. Mangalam University, Gurgaon, to present their paper on the topic, the role of psychotherapy in enhancing the lives of individuals with cerebral palsy. Miss
Ma'am,
Yashika.
yes.
Yes, ma'am.
No, ma'am, you can continue. Professor Dr. Kotz, ma'am, and Dr. Sunita, ma'am, I've just on your WhatsApp shared a sheet. It's a judgment criteria sheet. So this will give you a fair way how to bifurcate the marks. All right. Ma'am, you can call the first presenter, Dr. Shweta ji.
Yes, Miss Yashika, are you there?
Yes, ma'am, I'm there.
So please present your paper and share your
Yes.
slides, ma'am.
Ma'am, is my slide visible?
No, Yashika, you have to share it, please.
Yashika, try again.
Is it was visible?
Yes, now it's visible.
Yes.
Okay, just a second. Okay. Good morning to all the professors, delegates, and esteemed members. Today, I'm going to present on the topic the role of psychotherapy in enhancing the life of individuals with cerebral palsy. Manju ma'am was also a part of this, but due to some prior commitments, she's engaged, so she can't be here in this conference. So starting with the topic, so what is cerebral palsy? Cerebral palsy encompasses a group of neurological disorders that emerge in infancy or early childhood, permanently impacting body movement and muscle coordination. The condition results from damage or abnormalities in the developing brain that disrupts its ability to control movement and maintain posture and balance. So the term cerebral pertains to the brain, while palsy refers to the loss of impairment of motor functions. While the traditional management of CP has centered on physical and occupational therapies aimed at improving motor skills and functional abilities. So, individuals with CP often encounter significant psychological challenges, including anxiety, depression, and issues related to self esteem and self isolation. Now, what are the causes? Why does cerebral palsy happens and what are the effects of it? Cerebral palsy arises from various factors that affect brain development, typically occurring before, during, or shortly after birth. So, prenatal factors such as maternal infections, severe malnutrition, or exposure to drugs can affect the child's brain. Perinatal complications such as lack of oxygen during labor, premature birth, low birth weight, and birth injuries can also affect the brain of a child. And also infections like head injuries in early infancy can damage the developing brain of the child. Additionally, certain genetic mutations and chromosomal abnormalities may increase the risk of CP. Understanding these causes is essential for early diagnosis and intervention. Now, looking on what are the consequences of cerebral palsy? So, CP can lead to a range of significant consequences that impact individuals physically, mentally, and emotionally. Most notably, individuals with CP experience motor impairments that can affect their movements and coordination, leading to varying degree of disability that hinder their daily activities. So, like this isolation can hinder social relationships. It leads to the feeling of loneliness, as mentioned in Smith and Jones 2018. Furthermore, CP is more frequently associated with secondary health issues such as seizures, musculoskeletal problems, which additionally needs medical attention. So the consequences highlights the need for a holistic approach to care that addresses both physical and psychological needs of individuals with CP. Now, if you look at the statistical data of CP, so researchers highlight that approximately 30 to 40 of the individuals with CP experiences anxiety disorders, while 20 to 30% suffer from depression. And about 50% of the children with CP report low self-esteem and negative body images due to visible physical impairments, as mentioned in Colbert 2008. Social isolation is also prevalent, with around 60% of the adolescents with CP feeling disconnected from peers, which adversely affects their emotional well-being and social development. Additionally, these studies indicates that individuals with CP are 3 times more likely to encounter significant challenges in social participation compared to their peers without disabilities, as mentioned in Duhigg and Nankovitz 2020. Now, if we look at the psychological impact of CP, so what are the psychological impact of CP? Individuals with CP frequently experience considerable emotional distress, which are stemming from the chronic nature of the condition. The physical changes, such as pain and mobility limitations, can exacerbate feelings of anxiety and depression. Moreover, the constant struggle to manage daily physical challenges often leads to frustration and anger. So, self-esteem and body images issue are also common, as visible physical impairments can contribute to negative self-perceptions. Many individuals internalize societal stigma and grapple with self-acceptance, affecting their overall self-worth. Social isolation is prevalent among those with CP, as both physical and psychological factors can affect the relationship formation and maintenance. So, as mentioned in Kwan and No 2020. Now, what is the role of psychotherapy in this? So, psychotherapy plays a critical role in addressing the emotional and psychological challenges faced by individuals with CP. Uh, so, there are
I'm
many techniques
only
which we
two
can
minutes are
use,
left.
such as CBT, ACT, which provides valuable tools for managing emotional distress, enhancing self-esteem, and fostering psychological resilience. By integrating psychotherapy into comprehensive care plans, healthcare providers can more effectively address both the physical and psychological dimensions of CP. So in this context, psychotherapy becomes an essential component of a multidimensional treatment strategy aimed at achieving better overall health and well-being. Now, what is CBT? So CBT is the cognitive behavioral therapy, and it's a structured psychotherapeutic approach that focuses on identifying and modifying negative thoughts, patterns, and behavior that can adversely affect emotional well-being. For individuals with CP, CBT can be tailored to address the unique psychological and emotional challenges they face. CBT has been shown to be particularly beneficial for reducing anxiety and depression symptoms, developing effective coping strategies, and ultimately improving life satisfaction among individuals with CB. So, though it is structured intervention, CB can create a pathway to better emotional and psychological health for these individuals, as mentioned in McCarthy 2016. Now, what is ACT? ACT is acceptance and commitment therapy. ACT helps in the effective psychotherapeutic approach that encourages individuals to accept their difficult emotions and thoughts rather than suppressing them. So for those with CP, ACT helps individuals embrace their physical limitations and the emotions associated with them, thereby reducing the psychological burden of disappointment and frustration. Now, this therapy incorporates mindfulness techniques that facilitates the management of distressing thoughts, enabling individuals to focus on personal values and engage in actions that align with those values. So, the therapy also encourages psychological flexibility, which is crucial for adapting to the challenges posed by CP. Now, there is also a supportive
Yashika ma'am.
psychotherapy. Supportive psychotherapy often is
Yashika ma'am,
essential for
sorry ma'am.
emotional support and validation for individuals with CP, creating a
Yashika,
compassionate therapeutic environment
Yashika,
where
are you
they
listening?
can express their
Or
feelings
you
and
have
challenges.
muted all of us
Now,
on
by
the screen?
validating their experiences, supportive psychotherapy helps
I think
individuals
she is
confront
muted,
the
She is
Yashika.
not
psychological
listening.
aspects of living with CP, contributing to improved emotional well-being and a more positive outlook on life.
Can she not hear
If we look
us?
at a case study of
Miss
CP,
Yashika Yadav.
we'll discuss about a
Shweta, we
case
can send the
like
text
Arav's
to her.
case. Arav is a 16-year-old
All right.
boy with
You need to send message.
spastic cerebral palsy who present with significant motor impairments, chronic pain, self-esteem, and social withdrawal. So therapy was conducted at a learning
More than 10
rehabilitation
minutes.
center in Mumbai, where Arav participated in a 12-week CBT program. So the program included cognitive restructuring to address
She's
his
not
negative beliefs about his
responding
physical
to this
ability,
also.
behavioral activation to encourage participation in enjoyable activities such as art and music.
आप इसे म्यूट कर दें. Yashika, are you listening to us? Do you find our voice on your screen? Now you have been muted by the organizers since you were not responding to us. Are you listening? Just raise your hand if you're listening to us.
I think she's not listening us.
That's the issue.
That's really not possible, actually. I don't know what is the setting like because that doesn't happen generally.
No problem.
Anyway, we can go to the next presenter, Dr. Shweta.
Yes.
Okay, ma'am.
Message
you,
for her in the chat box.
Okay. Now I would like to invite Miss Aprajita Jain. Miss Aprajita Jain, are you there? From School of Humanities, K.R. Mangalam University, Gurgaon, to present their paper on the topic Psychotherapeutic Interventions for Acid Attack Survivors. Over to you, ma'am. Aprajita Jain, ma'am.
Good morning, ma'am. Is my screen visible?
No,
No.
Yashika,
Just
please reshare your screen.
yes.
Just let me.
Yes, now it's visible.
Yes.
Now visible. Okay. So, good morning to all esteemed delegates, professors, and my fellow attendees. This is Aprajita Jain from K.R. Mangalam University, a student of psychology and master's in psychology, along with Dr. Manju. And sincere apologies from her end, as she is having some prior engagement due to which she is unable to attend today's meeting. Yeah, so my topic is psychotherapeutic interventions for acid attack survivors. Acid violence is the deliberate use of acid to attack another human being. It involves hurling any corrosive substance onto an individual with the intention of killing, injuring, harming, and maiming or disfiguring them. The victims of acid violence are overwhelmingly women and children, and attackers often target the head and face in order to maim, disfigure, and blind them. The research conducted by UNICEF reveals acid attack is the serious problem all over the world. Even children are becoming victims of acid attack in many cases. In an acid attack, acid is thrown at the face or body of the victim with deliberate intent to burn and disfigure them. Most of the acid survivors are girls, many below the age of 18, who have rejected sexual advances or marriage proposals. Acid attack can be viewed to mean any act of throwing acid or using in any form on the victim with the intention of or with knowledge that such person is likely to cause to the other person permanent or partial damage or disformity or disfiguration to any part of the body of such person. And this definition is given by National Commission of India, July 2009. Then coming to the statistical fragments, vitriolage or the act of throwing acid is more prevalent in developing countries like India, Pakistan, Bangladesh, Cambodia, Colombia, and Uganda. Globally, 80% of vitriolage victims are women. 60% cases of vitriolage is perpetrated by familiar of the victim. Most cases are found in young age group between 20 and 35 years. Is my screen still visible?
Yes, ma'am. Yes, please continue. It has been humble request to all the participants to please concise your presentation within 5 to 7 minutes.
There are 250 to 300 acid attacks reported in India every year, but the real figure is probably closer to 1,000. India Today Data
हाँ
Intelligence
फिर भी
Unit
जैसे दुकान से लेंगे तो थोड़ा सा नाप के ले लेता है आदमी.
has found that between 2017 and 22, there have been 1483 victims of acid attack in the country. This is according to data released by National Crimes Records Bureau. The year 2017 witnessed the highest number of acid attack in these 5 years with 319 victims. An equal number of cases or even more goes unreported. This is almost or less than half the number of incidents in each year. Uttar Pradesh, West Bengal, and Delhi have been consistently ranking among the 10 worst states in terms of acid attack from 2017 to 22. These three states alone make up 42% of the victims of acid attack in India during these 5 years. Ma'am, is my slide changing?
No, it's
No, Aprajita.
no,
No.
no.
Mm. Is it now?
Yes.
Okay. Coming to the causes of acid attack, there are a number of reasons behind acid attack, majority of which stem from feelings of revenge and aggression. According to a study conducted by Menon and Vashist in 2013, the most frequent ground of acid attack violence is love rejection. The vindictive lovers never accept the refusal of the women as it humiliates their prestige, reputation, and honor. Dowry demand is another renowned cause of acid attack, as many Indian women claim that due to their failure to meet the excessive monetary requirement of their in-laws, they became the victims of decisive violent behavior. Other causes related to acid violence are land or property related disputes, marital disputes, revenge in between families, and other forms of sadistic pleasures by hurting someone else. Acid Survivors Foundation of India provides a tactical frame to delineating the reasons for acid attack. According to their report, 36% of cases arise from rejection of love and marriage, 13% arises from marriage discords, 11 from land-related disputes, and many more. Coming to the consequences, it is important to note that the physical trauma associated with an attack is extreme and has lifelong health consequences. The acid's corrosive nature leads to various degrees of burns, temporary or permanent blindness, partial or complete blindness, damage to skin and organs, and infections. Survivors of these attacks experience psychological concerns such as anxiety, depression, social isolation, and social exclusion. Other psychological correlates of attack include body image issues, self-blame, fear of rejection, and depression. Social isolation creates difficulties in finding a suitable job, limits their marriage opportunities, and increases relational problems within their family. Guerrero 2013 found that the participants have low self-esteem, constant fear of being assaulted again, a propensity to depression increased by the severity of their facial disfigurement, chronic anger due to the assault, and a permanent feeling of helplessness. To cope with these psychological trauma, there are a few psychotherapeutic interventions also. Acid attack survivors face a unique set of challenges that require exceptional resilience and coping mechanisms. The psychological trauma is equally significant, often manifesting as depression, anxiety, and post traumatic stress disorder. Survivors may also experience difficulties with social interactions, employment, and relationships. Coping with these challenges often involves seeking support from family, friends, and mental health professionals, developing effective coping strategies, and participating in support groups. The first is problem focused coping. It refers to the management of issues and distress by gathering information, planning, seeking support, and making decisions. The victims of acid violence adopted problem focused coping strategies such as seeking support, cognitive decision making, which involves accepting their new identity, making a routine, developing confidence, directing problem solving, that is, using a scarf, maybe avoiding sun exposure, and avoidant action. Then second is social support. Different social support systems can play a significant role in helping survivors for acid attack coping successfully in mitigating the impact of such violence. The role of family members is acknowledged in providing all types of support such as financial, emotional, physical, and medical legal support. However, there are gender differences in providing different kinds of support such as the financial and medical legal support generally. Counterfactual thinking, one of the components of post-traumatic.
Aprajita ma'am,
Yes, ma'am.
sorry, Aprajita ma'am, please conclude your presentation.
Okay.
Only 1 minute is left.
Okay, so on giving the conclusion, I just want to summarize the psychotherapeutic role in the acid attack violence. That is, through therapy's light, they can find their way. A brighter tomorrow starting today. Those scars may stay, the pain won't last. Empowered by care, they move on from their past. Thank you so much.
Thank you, Aprajita ma'am. Thank you so much. I am requesting again to all the participants to please concise your presentation within 5 to 7 minutes. 2 minutes will be left for conclusion. Now, I would like to invite Mr. Jitendra Kumar from Saraswati College of Professional Studies, Ghaziabad, UP, to present his paper on the topic strengthening community participation in lifelong learning. Mr. Jitendra Kumar, sir. Jitendra, sir, are you
Mr.
there?
Jitendra is not there.
All right, ma'am.
Okay.
Let's move to the next presenter.
Dr. Sarita is also not there.
Sarita Anand. Okay,
Next
ma'am.
is yours, ma'am, Tanya ma'am.
Can we have the next one before, ma'am? Is it possible?
Armina. I made her
Armina.
I'll because I'm connecting with the other two on phone. Let me
Okay,
just
ma'am.
take a follow-up.
Sure, ma'am. So Armina Khatun may be called for her presentation.
Ms. Armina Khatun from K.R. Mangalam University, Gurgaon, to present her paper on the topic Fostering School, Community and Home Partnership for Inclusive Education of Children with ADHD. Ms. Armina. Armina, ma'am.
Yes,
Armina Khatun.
Armina, you are being made as a co-host, so you can share your screen. and you may start the presentation. Are you ready, Armina?
She is unmute. She is muted, ma'am.
No, I have made
Now,
her co-host,
unmute.
so she has all the
Okay, okay.
rights to do presentation. Or,
Yes, yes, yes.
yeah. Next participant will be the Khushbu.
Miss
Let
Khushbu,
me check. Armina, but you are unmuted. I think there is some network issues with you. So, till then,
Miss
we can call the next participant,
Miss Khushbu.
Ms. Khushbu Yadav.
Yes,
Miss,
ma'am.
Huh.
okay. Now I would like to invite Miss Khushbu from K.R. Mangalam University, Gurgaon, to present her paper on the topic Exploring Psychotherapeutic Interventions for Visual Impairment, Insights and Strategies. Over to you, ma'am. Khushbu, ma'am.
Ms. Khushbu,
Khushbu,
you can
ma'am.
start your presentation.
Ma'am, I am audible.
Yes, ma'am.
Yes, beta.
Okay. So I'm Khushbu Yadav. Good morning, everyone. I'm Khushbu Yadav, student of K.R. Mangalam University. My paper title is Exploring Psychotherapeutic Intervention for Visual Impairment, Insights and Strategies.
Provided for kind of security for India for centuries. The British called this as a buffer zone for the
Rachana,
British,
ma'am, please
and it
mute
provide
all
for
the
the
participants.
cushion between the empires.
Yes, done. Yes, Khushbu, you can start now.
Yeah. So first I will talk about what is visual impairment. So as per the ICD-11, visual impairment is a disorder of the visual system. Visual impairment include the two types of the loss. One is low vision and second one is blindness, which cannot be corrected by any glasses or any surgery. So India was the first country in the world to launch the national program for control of blindness in 1976 with the goal of reducing blindness to 0.3%. In 2015 to 2019, there was a survey, the National Blindness and Visual Impairment Survey, was conducted by the Dr. Rajendra Prasad in order to provide the evidence about the present status of blindness and visual impairment in India. So in 2010, there was a data of visual impaired is 55 million. In 2015, there was 60 million. In 2020, there was 62 million, and 2024 there is 67. Around 30 million people in India are visually impaired, which represent the 2.7% of the total population. Rural areas represent the highest rate of the visual impairment, which is due to the limited access of the healthcare services. The percentage of the population with access of the eye care services is in urban area there is 80% and in rural area there is 40%. This is the graph of which shows the visual impairment percentage of the state. So Kerala and Tamil Nadu shows the lowest rate of the visual impairment, which implemented the successful eye care program and the treatment initiative. Meanwhile, UP, Bihar, and MP states are having the higher rates of the visual impairment, which link to the social, economic condition and healthcare access. There is a literature review. In 2020, the research study was conducted on visual impairment and mental health. The result of the findings is that which shows that the rates of the depression and anxiety are among the people with the visual impairment. And the other study in 2016, which on the topic of psychosocial implication of the blindness and low vision in the students of the school for children with the blindness. The result of the study was out of 40, 55% out of them were found depressed and 50% out of them were having difficulty in making new contact and 52% were satisfied with their family care. This study showed the blindness of the low vision does have psychological implication like feeling of guilty, anxiety and sadness and depression. There are some psychotherapeutic interventions. Interventions are successfully with the help of the psychotherapeutic approaches. There are some issues which are faced by individuals who are visual impaired. They find difficulty to adapt their situation, which can lead to anxiety, depression, or stress. Visual impaired people can also lead their social isolation, which can shows the result of loneliness and the other issues is that individuals with the visual impaired people believe that how they perceive them, that how other people perceive them, and which can affect their self-esteem and confidence. So there are some psychotherapeutic approaches, which is CBT, cognitive behavior therapy, which focus on the thoughts, feelings, and behavior. And CBT focus on the identify changing negative thoughts pattern and help them manage in a positive manner. There is a study on the cognitive behavior group therapy for blind and visual impaired adults. In 2019, this study provides the ways to help the people with the vision problems and gives practical tips on how to overcome challenges they face in getting effective treatments. The other is mindfulness therapy. Mindfulness therapy uses the medication, relaxation, and awareness to help the focus on the present moment. The study on the mindfulness therapy is in 2014 on the topic of mindfulness, spiritual well-being, and visual impairment. This study shows that the practicing mindfulness helps the people feel more connected to themselves, others, and even something community or spirituality. This sense of connection can lead to the improvements in their emotional, social, and physical health. The other is group therapy. Group therapy deals with the group talks or sharing of experiences or problem solving. The study on the group therapy was conducted in 2017 on the topic of exploring the effects of the group therapy for the visually impaired. And this study investigated the effectiveness of a brief stress management group therapy. This study result shows that individuals need at least 16 weeks of the intervention to experience a significant reduction in their stress levels. There are some insights. Individual differences. Each person experience or each person visual impaired person are different. So visual impaired is unique. So intervention should be according to their needs or according to their plans. Holistic approaches. Addressing both the physical and emotional needs is critical for the effective treatment. Collaboration. Psychotherapeutic approaches can be made more effective by coordinating with the occupation therapist, rehabilitation specialist, and other professionals. There are some strategies for visual impairment. Regular assessment to identify the mental health needs. Education and awareness. Providing the education and teaching them clients about their psychological effects of the visual impairment. Goal setting. Clients should be set the achievable goals which can enhance their motivation and engagement in therapy. Community resources. Encouraging involvement in community or in society groups, support groups or activities for their connection and reduce the isolation. There is a study on the viewing strategies in children with a visual impairment and children with a normal vision. This result shows that of this review are integrated with the different attention network system, which provide direction on how to design future intervention, targeting the use of the viewing strategies to improve different aspects of the visual processing. Conclusion. Psychotherapeutic intervention for the individual with the visual impairment are essential in addressing their unique mental health challenges. By employing a range of strategies and fostering an understanding of their experience and mental support, creating psychotherapeutic approach and respect individual difference and promotes. Resilience is the key to enhancing their overall well-being. Thank you, ma'am.
Thank you so much, ma'am. Our next presenter is Miss Amrina. Miss Amrina, are you ready?
Yeah, she is ready. She was not able to unmute. She's there. Can we just see if she can be unmuted? She's at, yeah.
Ma'am, she is co-host and
Armina, can you
Yes.
speak? You're already co-host. Can you hear us? Armina? Miss Armina?
Actually, I faced the same problem
She's saying
yesterday.
she's saying I'm speaking, ma'am. No, but if you're
She's,
speaking,
but I think she's muted.
all right.
ma'am, there must be some network issue. Otherwise, she is saying that she is speaking.
Yes, yes.
Uh,
All right. So
Tell her to rejoin. Tell her to rejoin.
please try rejoining once again, Armina. Ma'am, in the meanwhile, put a final call for the other two paper presenters. Otherwise, then we don't entertain.
Okay.
now,
Mr. Pravesh Sharma.
Parvesh Sharma,
No,
he's
just
there.
1 minute. Is Mr. Jitendra Kumar here? Dr. Sarita Anand? All right, ma'am. We can mark them as absent. We'll move ahead.
Fine, ma'am.
Okay. Now I would like to invite Mr. Pravesh Sharma and Dr. Pushkarni Panchmukhi from RV University, Bangalore to present their paper on the topic Multilingual English Language Teaching in India, Teacher Perspective and Practices. Over to you, Mr. Pravesh.
Yeah, thank you, ma'am. Just a minute. I am asking Dr. Pushkarni to join because I told her 11:35, so she must be waiting for it. So I'm just dropping a message.
You can start. You can
Or
start.
I can start. Okay, I'll start.
Yes, please start. You carry.
Yeah, thank you. First of all, I would like to begin with extending gratitude to CTPD for giving me this opportunity to present a paper in front of such an esteemed gathering of such experienced educators and trainers. Thank you so much. Very good morning to all of you. Now I start sharing my screen, and please count my time once my screen starts showing.
Okay,
Yes.
no issues.
Can you all see my screen, ma'am?
Yes, yes, sir.
Yeah, thank you, ma'am. So my research is on multilingual English teaching of India. English teaching in India means incorporating other languages in teaching English. English, when not taught in only English medium of instruction, when it is taught in child's native language or by integrating any regional language. So that's called multilingual English teaching. Now, because our national education policy also has a lot of focus on teaching English by incorporating child's native language, and overall it has a lot of emphasis on multilingual by promoting regional languages and child's local language. English should be taught alongside other languages. That is what NEP 2020 suggests. In India, it is already happening, but in a very unstructured way. Now, my research here is not about the benefits of multilingualism because it is already an established fact, and there have been conclusive research into it that multilingualism in English teaching has a lot of benefit. But some studies have also raised some concerns. For example, a study in US and a study in France, they suggest that if the child's first language is limited, if the exposure to first language is minimized, and English is mostly the medium of instruction, then the child does better communication and better writing skills or better reading skills. But it is not everything, because it doesn't do away with the English. Sorry, it doesn't do away with child's first language. Absolutely, child's first language is still used, but it is used in a limited way. Now, in Indian context, there's a different scene, and there has not been much research when it comes to Indian context. Of course, there has been a lot of research in other countries. In India, our children, they already come with some languages. They speak at least one or native language, one or regional other language, and these often bring valuable language skills to schools. There is also this concept called funds of knowledge by Louis Moll. So they say that we can build on the prior knowledge of the child. The knowledge of English also can be built on the prior knowledge of the language which a child brings to school, because it will give more insight into his language traditions, local environment, economic practices, and then general well-being. In India, NCF 2005, NCF 2023 has also a lot of emphasis on preserving local languages and multilingual teaching. Also, UNESCO wants this. They must demonstrate proficiency and literacy in both their home language and English language. So, on the other hand, research has also suggested that children who know different languages, or who are very good in their home language also, in their native language, they have more cognitive flexibility, they have more problem solving skills, and they have good memory also. So dual language or bilingual models, they have been proved to be very effective in the classrooms in countries like South Africa and also some other countries. This research has already happened. In India, there have been some educators like Dr. Ramakant Agnihotri, who has worked with his colleagues from JNU, and who have turned who have coined this term called multilinguality. So they want that a child, they actually believe that Indian children, they are capable of acquiring multiple languages. It's a unique feature of our Indian society, where individuals naturally use a variety of language in everyday life. Also, international organizations like one from Austria and then BBC, they have done a lot of intensive research on benefits of multilingual teaching of English language, and they support it. Now, in India, we also have some challenges. One of the challenges is the social, political, and institutional barrier, where even if a child's regional language is incorporated, for example, in a classroom, even if as an English teacher, I teach them by integrating Hindi, then what about the child's native language being Haryanvi? If a child speaks Haryanvi at home, then that language is going to be marginalized. In the same way, in some tribal schools of India, in Odisha or other parts of India, these studies have already happened by Mohanty and others, that a child's tribal language, his native mother tongue is very different from the regional language, and which is again marginalized. It creates a double divide again. So this is one of the challenges, even if we integrate other language, because how many languages will we integrate? In a classroom, there could be so many children with so many mother tongues. So this is one challenge. And then the limited research on the effective approaches. We don't have strategies already designed for teaching, for integrating other languages into English classrooms. Our textbooks are also not designed in that way. This is one challenge. And the another important challenge is the attitude of our society and perceptions. Still, all our stakeholders, they give a lot of importance to English as a language of opportunity. Even parents don't want that English should be taught in child's language. I'm sorry, I'm not feeling well today. So even parents and other stakeholders, they don't want that their child should be taught English in any other language. So this is because they want this English to English medium. This is one of the problem of the attitudes. Then practical classroom challenges are the teachers are not able to manage incorporating different language because there is no clear policy and no clear pedagogical strategy to guide teachers. That is why I conducted a survey where I approached some teachers from rural India and urban India. And I got to know, and also because it was my prior experience, that in Indian schools, teachers are already using multilingualism. They actually don't teach English in the English medium, especially in our rural Indian schools. But it is not because they know the term multilingual teaching. It is mostly because maybe teachers are also not well conversant in teaching in English instruction. And also sometimes students are not able to understand when they are taught in English medium. Even English language. So the teachers, they take help of child's language so that things become more clearer and the child learns. But it happens in a very unstructured way. NEP 2020 wants it to be more structured, more effective, and it to be a part of curriculum. So in my study, in my survey, I had approached 57 teachers who had, most of them had over 10 years of experience and more. And they were all middle school teachers. Most of them were middle school teachers. And my questions were on knowing their perceptions. What do they think about the benefits and challenge of using or integrating mother tongue? What strategies, if at all there are any strategies, what are they using? And whether they are getting any teacher training related to integrating languages and all, or and what is the impact on students if they are using it systematically, or even if they are not using it systematically, but what is the impact that they think, how impactful it is. And so this research can guide teacher training and educational policies ultimately, if I do more work into it. Now, the study is a descriptive research design with the survey method, as I've already discussed. And now I'll go to the survey once. Most of the schools were rural schools. In fact, and only some of them were urban. Then most of them were private schools. So it could be because of the increasing popularity of private schools in our Indian villages. Teaching experience, as I already told, they had more than 10 years of experience, and they were mostly middle school teachers. Now, what did they suggest in the survey? Most of them had positive attitude. They wanted, English should be taught by integrating other languages, but some of them also were a little uncomfortable. So there is some need of improvement in that area, that why these teachers were a little uncomfortable in that. And also they believe that it is very beneficial. Again, I have got a very overwhelming positive views about the benefits of it. How challenging? 21% of teachers, they find it very challenging. So this indicates that they need some support and resources so that their difficulties can be overcome. But majority of teachers, they find it somewhat challenging, and a significant portion, they think it's neutral. They are okay with it. And when I ask them about teachers training, so most of the schools, teachers trainings are happening. That means schools these days are aware of the importance of giving teachers training to them. So, but it is not consistent. It is not happening consistently. That is one problem. Now, teacher training about multilingual, how well does it prepare them? So it was a mixed perception, because teacher training may happen in other areas, but multilingual teacher training, so it is still needed to be addressed. Now, next, which areas of training they wanted? Most of them, they wanted good textbooks, bilingual textbooks, classroom management, and they wanted clear guidelines on how to integrate languages, how to integrate other languages into English teaching. About students' impact and students' outcomes, most of them, they say that children, they grasp English language better and concepts better when explained in their mother tongue. So this is what it was. 85.9 of them, they think like that, English teachers. And
Sorry, Parvesh sir. Please
yeah.
conclude your
Yeah.
presentation.
So that's all. And yeah, here my presentation concludes, wherein I'm suggesting that what they want is they have a positive outlook. First thing, they also know the benefits, they recognize it, but they have challenges like they don't have bilingual textbooks. They want bilingual textbooks. They want training. Trainings are happening, but consistently not happening. And also, then they are concerned about the time. How will they manage time, and how will they cover syllabus if they are integrating other languages? That is one of the concerns. So this study, it emphasized on the need of continued support to the teachers' training and the policies. Further research is necessary to understand the long-term impact on the student outcomes, especially in the rural settings, so that new strategies can be devised to overcome whatever challenges we are having today. And these are some of the references.
Thank you so much, sir.
Thanks.
Dr. Shweta, a moment.
Yes,
I would like Pravesh, you just introduce within 1 minute yourself.
My name is Parvesh Sharma, ma'am, and I am a research scholar at RV University, Bangalore. I'm doing my research on multilingual teaching of English language.
You're from education?
Yes, ma'am. I mean, it's an interdisciplinary research chapter. I have my master's from English literature, but because I want to do something in English teaching, ELT, so that is why I opted for this.
Thank you. Thank you, Pravesh. Thank you. Thank you, Dr. Shweta.
Shall I continue, ma'am?
Yes, please. You may.
Okay, thank you, ma'am. Now I would like to invite Professor Dr. Tanya Gupta from K.R. Mangalam University, Gurgaon, to present her paper on the topic Mental Health Support Systems in Schools, a Pathway to Equitable Education. Over to you, ma'am.
Thank you, ma'am. Ma'am, is the screen visible?
Yes, ma'am.
Okay, ma'am. Thank you. So, good morning, esteemed chair and co-chair of the track. Thank you for providing me an opportunity to present my paper. A study that has been conducted on mental health support systems in school, a pathway to equitable education. As we know, out of the 5 pillars of education, and especially when we talk about the National Education Policy 2020, where we're talking of access, equity, quality, inclusivity, affordability. One of them, the 5 pillars, is enhancing equity. So, study has been conducted to really understand how mental health support systems in schools can be a pathway for equitable education. So, as we all know that education has been universally recognized as a key to social mobility and economic prosperity. However, to achieve equitable education, and that they have access to quality learning and opportunities. We know this. Several studies and policy reports have also indicated that this is a challenge for us. And among the various challenges that we see for achieving equitable education and therefore having access to even quality learning, one of the overlooked factors is students' mental health. So from this emerged the requirement that we should have some kind of study which is done on mental health support systems in school. And ideally, this is very vital to ensure that all systems, and especially those who are from marginalized communities or they are from difficult circumstances, they can also access and benefit from education equitably. So a few studies have been reviewed on this topic to build an understanding and to carve a way forward. And I would like to here just quote two main studies which are a part of the paper that has been submitted. So one of the studies by Smith and Roberts 2021 explores the relation between mental health and educational outcomes, and it was found that students with untreated mental health issues are at a high risk for poor academic performance, absenteeism, and early dropouts. Another study by Gibbs 2020, uh, uh, the empirical study actually found that mental health challenges such as anxiety, depression, and trauma disproportionately affect students from disadvantaged backgrounds. The second segment that I want to speak about here in literature review is the mental health support systems in school. So, what kind of mental health services are being provided? So, a study by Reed and Garcia 2019 reveals a multiple number of support systems like counseling, mental health education, and peer support networks. And another study which speaks about how if we have a robust mental health support system, it can enhance retention rates and improve academic outcomes and create a more inclusive atmosphere. Further, how is mental health related to equitable education? So, Kumar and Sharma 2022 have found through their study that once the students, and each student in specificity, if they get support, they can succeed. And especially children, this study focused on children from vulnerable groups and low income families and minority communities. So here also, if such kind of a support system is given, the students can perform better. So a study uh, was undertaken. This has taken about 4 months to do this work. So um, basically the methodology, a mixed method approach, where a quantitative survey with data collected from 200 school students of secondary level from 4 public schools in Gurugram, Haryana. The parameters in the questionnaire that has been put, the survey is taking their academic performance data and covering mental health matrices like absenteeism, emotional distress, and related factors. And qualitative insights have been taken through semi-structured interviews. So from these 4 public schools, 2 school counselors from each school, and a total of 40 secondary school teachers. So that is 10 secondary school teachers from each of the schools. And the 200 school students that we have seen, 50 students across the same schools. In general, we have given them a semi-structured interview, basically to understand the challenges faced and what can be the ways in which these can be overcome. Major findings, if I would report here, is one on academic performance and mental health support. So the quantitative analysis reveals a positive correlation between presence of mental health support systems and students' academic performance. And students who were provided active mental health support programs have shown 12% improvement in their overall student grades compared where the systems were not much functional. Also, the absenteeism rate has reduced by 18%, which says that mental health support can enhance student attendance and engagement. So this correlates with the earlier findings as well. Secondly, with the emotional well-being and inclusivity is concerned, the semi-structured interviews that were conducted on students and teachers and the counselors show that there is a crucial role of mental health services in creating an inclusive school environment, and students who have regular counseling support services being provided, they feel more supported, they feel that they are more resilient, they can adapt, they have higher engagement levels in classes, and they feel good about being at school and participating. And teachers also suggested that there are mental health challenges, and students can succeed if they are given support. Third is the reduction in the achievement gap. So mental health support systems can especially help in reducing the achievement gaps, especially of students who are from marginalized communities. So most of the public schools, though, did not have as such very low income families, but if we do compare that, somewhere not really better off as the more privileged peers, there is certainly an improvement in the grade of such students, though not very significantly, but marginally. And the study has also relieved certain challenges that have come out through the semi-structured interviews, that there is not much, there are limited resources, there's inadequate staffing, and specialized training is required. And therefore, this is one of the important findings. And there's also stigma around mental health in some communities that leads to underutilization of available services, especially among minority students. So, discussion and implications. The correlation between mental health support services and improved academic performance aligns with existing research, while the reduction in absenteeism and achievement gaps provides new empirical evidence that mental health interventions are integral to create an equitable education system. And secondly, increasing resources, training educators, and engaging communities in destigmatizing mental health are key steps that will help to build this support system. Finally, the positive outcomes demonstrated by mental health support systems provide an argument for the policymakers to prioritize mental health in education, and have ensure that there are necessary resources and trained personnel for this. And mental health support should be made as a mandatory component of the curriculum. Also, the last is that parents and guardians have a crucial role, and community partnerships, such support networks, and collaborative efforts, local health services, all this can network with the schools so that we can have a very good mental health program for our children. Conclusion. The study reveals that mental health support systems positively impact not only academic performance, but also emotional well-being, attendance, and social inclusion of students. And second, successful implementation of such programs requires adequate resources, specialized training, and community engagement to address challenges and barriers that presently exist. So thank you so much for giving me this opportunity to present my paper. Thank you.
Thank you, ma'am. Thank you so much for this wonderful presentation of mental health support system in schools. Now we have Miss Armina Khatun. Miss Armina, are you there?
Ma'am, she's there, but I think still she has a problem. So I don't know really.
Actually, I shared with her a link again.
She is not able to speak actually. Ma'am, what do we do? You may please guide us on this, because can we?
Is she from Kashmir?
No.
No.
From here only.
Then maybe, I don't know what problem she's facing. No problem. Then okay, you may take her presentation theoretically. Tell her to give you theoretically that presentation instead of coming on the platform, right?
Yes.
And let's consider her paper.
All right.
Although she's not able to present due to so many, there's glitches, which you can control.
We
right?
can send her, we will send her presentation to you in case you feel that it is okay. We can count her in for the scoring process.
That's better. That's better.
Thank you.
Okay. Thank you, ma'am. Is there any presenter?
I think all are done, ma'am. We can move ahead.
All done. Two are absent, Mr. Jitendra and Dr. Sarita.
So, ma'am, we can move ahead. Dr. Shweta ji.
Yes, ma'am. Yes, ma'am. Just give me 1 minute, ma'am. I'm sharing my slides. Yes. My slides are visible, ma'am? Now we are indeed gaining a wealth of knowledge today. May I invite Dr. Sunita Devi, ma'am, to summarize the session and address the participant of the session.
Thank you so much, Dr. Shweta. And first of all, let me give my, heartful thank you and gratitude towards the organizer and Professor Tanya Gupta, ma'am. And on this community engagement, partnership, research, and innovation for inclusive and engaged learning. So it was a wonderful presentation by all the paper presenters. There were total 5 presentations and one we couldn't get it. So the presenters gave this beautiful presentation on inclusive topics, whether it's a role of psychotherapy in enhancing the lives of individuals with cerebral palsy or acid attack survivors, or whether it's a visual impairment, and how our the learning of the language helps us to be more inclusive, which was given by Pravesh, and mental health support system in schools and pathways to equitable education by Professor Tanya. A beautiful presentation, very crisp, and I'm sure this new research is going to add lots of values to the current literature, and the researchers will definitely provide lots of inputs to bring the inclusivity in our education system and make this a lifelong learning. So when we talk about, so thank you and congratulations to all the presenters for a, beautiful presentation. And if we talk about, the phrase equitable quality education for lifelong learners, it's a commitment to inclusion, which align very closely with the goals outlined in the Incheon Declaration and the Education 2030 Framework for Action. And these initiatives not only emphasize the importance of providing inclusive and equitable quality education, but also focus on promoting lifelong learning opportunities for all, irrespective of their diversity, irrespective of ability or disability or disadvantage. So we have to provide this lifelong learning opportunity for all. And the key aspect for this particular equitable quality education, one is inclusivity. So when we talk about inclusivity, it is basically ensuring that all the learners, regardless of their background, regardless of their ability, they should have the access to quality education. And when we talk about equity is not just giving each and everyone same. No, equity is basically addressing the disparities and the inequities in their education to provide fair opportunity for everyone. So everyone get their, opportunity based on their disparities, not just because everyone should have the same, because their abilities are different. So we cannot have same for everyone. Based on their ability, we give them fairness or equity. And when we talk about lifelong learning, it is basically promoting continuous learning opportunity from early childhood through adulthood, including technical, vocational education, and training. And when we talk about these principles, they are very crucial for creating an education system that supports all learners and will help them achieve their full potential. And this equitable education is also aligning with the UNICEF Sustainable Development Goals, which we talk about goal number 4, quality education.
So quality education is basically ensuring inclusive and equitable quality education, which promote lifelong learning. So the question is, how do we create that? How do we ensure what strategies and action we should take to create this equitable quality education for everyone? So number one is we need to focus on inclusive education policies. So in India, we have number of policies which talk about inclusive education, and we need to develop more and implement policies that ensure all learners. So implementation is very, very important. Having the policies, but when it comes to the implementation execution, sometimes there we see the disparity. So it's very important to focus on developing and implementing these policies regardless of their background, have access to quality education. Then we also need to focus on early childhood education, because that builds the base for all other learning which you have in your life. So invest in early childhood education to provide a very strong foundation for lifelong learning. So the quality early childhood programs can definitely help bridging the gap for disadvantaged children, and they can prepare them for future educational successes. The third strategy or actions which we can have is which have come across through Professor Tanya's presentation and even Pravesh's presentation, that focusing on teacher training and support system. So providing ongoing professional development for teachers, for school counselors, to equip them with the skills and knowledge, so that whatever needed support diverse learners require, we can provide them. And it includes inclusive teaching practices and cultural competency. Another strategy which we can have is focusing on developing curriculum and the assessment system in such a way that every child can have learning and can participate in the fair assessment system. So designing curricula that are relevant, which are inclusive, which are adaptable to the needs of all learners. And assessment should be fair and provide meaningful feedback to support student learning and development. And all our education system is having the provisions for children with a disability, children with who are having struggle with the languages and all. So when we talk about inclusion, it does not mean only disability. Any disadvantaged group, when we modify to adapt them and adjust them in our system, that is what inclusive education is. Another important strategy which we can have is safe and inclusive learning environment. So physically safety we all talk about, but what about psychological safety? So when we say psychological safe learning environment, is where the child is or the learner is having the trust, where they feel that we are accepted, and they can have the trust in that system, and they can develop themselves. So creating learning environment that are safe, inclusive, and conducive to learning is very, very important to bring this gap between the separate disadvantaged groups. So we have to include them in the system. The another important point which we are talking about, and even the topic for our presentation, is community and parental engagement. Until unless we include the community and engage the parents, no strategy will work, because they are important members of the society, and they are important members which whatever action and strategies you are carrying out, they will further strengthen your strategy and action. So engaging families, community in the educational process will definitely build a strong partnership between schools and families, and can support student learning and well-being. Then lifelong learning opportunity. Another thing is, it's learning is not stopping only in the school or the colleges. Learning happens throughout life. So promoting lifelong learning by providing opportunity for adult education and vocational training and all. And we have a beautiful system coming up with the largest MOOC system called SWEM. So government SWEM, where even the anyone can enroll themselves and get the certificates and have lifelong learning opportunities. So government is providing lots of opportunities for everyone to continue their education. And the last but not the least, using of technology, because if we do not adjust with the changing technology, this is a technological era. Right now we are sitting, I'm sitting in Secunderabad, someone is sitting in, Amritsar and, Bangalore, another part of India, and we all are coming together. And that's what, a beautiful example of inclusivity in our system. So using of technology to enhance learning and provide access to educational resources can be a very wonderful tool to, bring inclusivity in our system. So this can be very particular beneficial in reaching remote areas or undeserved populations where, they do not have access. It is taking lots of resources to come physically present there and provide, give the paper presentation. But because of the technology, we are able to include each and every person from all part of India, not only India. It is an international workshop, conference. So from all part of the country and the world coming together, sharing their beautiful researches and their wonderful work which they are doing to create a more sustainable educational system, and creating equitable and the inclusive learning for each and everyone. So by focusing on these areas, definitely we can work towards achieving equitable quality education for all learners. And I'm sure that with this kind of effort, which CTPD conference, 2024, the second conference, has put lots of effort, and these are commendable. And I really, appreciate and congratulate the organizers for arranging and organizing this beautiful conference. And I'm so happy to be part of this. And as we say, lifelong learning. So this was a wonderful learning for me as well, to know lots of research is going on in the field of, inclusive education. Thank you for giving me this opportunity. I'm grateful for the organizers, and congratulations for organizing and conducting this beautiful 2 days conference, international conference. Thank you. Thank you, Dr. Shweta, and thank you, Dr. Tanya. And I'm, definitely the chairperson, Dr. Deepa ma'am. It was wonderful to, be with you and, learn from you. And I wish one day I meet you in person, and because I have heard lots about you, and in the field of education, you are doing a wonderful job, and we look up to you. Thank you for being part of this conference.
Definitely we'll meet. Definitely.
Thank you so much, ma'am. Your insights have been profound and shall serve as a guiding force to one and all in this session. Thank you so much, ma'am. Now, please accept as a token of gratitude from the organizers of the conference, the virtual memento, ma'am.
Thank you so much. Thank you so much for making me part of this, and it was a wonderful learning for me as well.
Thank you, ma'am. Thank you so much. We eagerly await insights and reflections on the proceedings of the session. May I invite Sikandar Kaur, ma'am, to for the closing remark, ma'am, please. Sikand, ma'am, please, I want to invite you for the closing remark.
As far as the briefing of all the papers and the concerns, Dr. Sunita has done it wonderfully. And what I gathered from the presentations, that we all should develop a perspective with regard to inclusion, quality, and concerns and pedagogies. We are sitting at our places, independent places, thinking differently. But when we come together on such platforms, we culminate all the ideas. It is the paper presenter who talked about cerebral palsy. I was wondering that there is one short film, I Am Dija, that is a very, it's so obvious in its theme, in its pedagogical approach, in its in the approach that how learner has taken up his own policy, what is attitudinal development, and how that learner is able to change the attitude of other people. So I was looking for such type of presentations also, that the people who are actually practicing in the field for inclusion, the practicing practitioners, they will also come up in the field in this conference. So next time I would request Professor Tanya to have such, I mean, specifically we should have those people on the platforms who are practitioners in these fields, because they are able to tell you the ground realities. Then it's I mean, one paper caught my attention, that was multilingualism. Recently, there was a hue and cry in our English class. The teacher was teaching using local language also. She was teaching English using local language. And the students, they objected to it, that why she's not teaching in English. Our teachers have been using different languages, and they were not knowing this is multilingualism. We should try to propagate such concerns through these organizations. Now, since this organization is for professional development of teachers, we should try to propagate these concerns to all those teachers who are working in the field of languages, and not only languages, in other fields also, that multilingualism is an approach which helps to trigger all the brain cells from different angles. That creates an impact on the learning of the learner. So then mental health, of course, is a great concern. I'm also one of the consultants for this mental health and counseling sessions through this NLP. It's really a great concern. I would say it should be the first concern of the teachers. Mental health should be the first concern of the teachers. Instead we start with the academic outcomes, with the achievement outcomes, with the performance outcomes. We should start with the mental health outcomes first. That's really important. And these were the wonderful issues which were raised here. And the most important thing, paper presentations by Tanya, by Pravesh, they were done in a technically correct manner, I would say. They were done in a technically correct manner. So whosoever are presenting on the platform, they should know what are the technical features of a research paper presentation, or a theoretical paper presentation, or a concept paper presentation, or a position paper presentation. That's really important. So I'm really very happy to be part of this conference, and I would say I had a very productive Sunday, forenoon of Sunday. It's really enriching experience to listen to different perspectives, to different speakers, especially to Dr. Sunita, as I am also having special education in my department. We are having be it special education, multiple disabilities. And we look forward for experts from the specific fields. And I believe she is from Rehabilitation Disability Center. So that's a good thing that I got connected to her and through this conference. And this is what these conferences are meant to be. Let's pool our attitude and perspectives together. Thank you so much.
Thanks a lot, ma'am.
Thank you, ma'am.
Yes, Shweta.
Yes, ma'am. I might just wait. I'm sharing. Thank you so much, ma'am. Ma'am, thank you for your insightful closing remark. Actually, your words have provided us with the profound perspective on the significance of this session. Please, ma'am, accept as a token of gratitude from the organizer of this conference, this virtual moment, ma'am. Please. Thank you so much, ma'am.
Shweta ma'am, please display the slide of virtual memento.
Ma'am, I'm sharing, already sharing.
No, but it is not showing.
It's not sure. Just wait.
Reshare. Reshare it.
Yes.
Yes, now it's shared.
That's really very, I mean, beautiful slide. I would love to
Thank you
have
so
it
much,
on my
ma'am.
email, and do kindly send on my mail also.
Yeah, for sure, ma'am. We are going to send.
Yes, ma'am.
Thank you so much. Thank you so much. And all the best for your rest of the day.
Thank you, ma'am.
Thank you, ma'am. Ma'am, is Tanya ma'am with us?
No.
Is she joined?
I think
Okay.
she has to join some other meeting. So she.
Okay. But
Now
ma'am,
you-
actually, yes, as we approach the conclusion of the today's technical session, we have a special memento to acknowledge the outstanding contribution for Dr. Tanya ma'am as a convener of this track 4. So, ma'am, the dedication and expertise and leadership that she played a very crucial role in the success of this track. And we are honored to present ma'am with the virtual memento as a token of our appreciation. Thank you so much, ma'am.
Ma'am, please
Now,
the slide. Tanya ma'am's slide.
ma'am, it's a memento. Is it not
Memento
visible?
slide is not showing. You just stop
Okay, okay.
sharing. Stop sharing.
Nah.
It's okay.
Okay, ma'am. Okay. Ma'am, the another slide is another gratitude is for the both the conveners of the track 4.3.
I am sharing the slides, ma'am.
Yes, ma'am. Is it visible, ma'am?
Yes, it's visible. Ma'am, no need to share our slides, our mementos. We are hosts only. You just go forward.
Okay, ma'am. Okay. Okay,
Stop
ma'am.
sharing
Just
and
hold.
move forward.
Okay. Now I would like to invite the co-convener of this track for the vote of thanks, Professor Dr. Rachna ma'am. Please presenting your vote of thanks for this track.
Thank you, ma'am. Thank you so much. Tanya ma'am has rejoined, so I think she will close the vote of thanks. She's just joining.
Okay, now I would like to invite
Let,
Dr.
let,
Tania ma'am.
let me check. Let me check. She was.
I'm here, ma'am.
Yes, yes, ma'am. She is.
Yes,
I
She is.
rushed to another track. I had a paper there also, so Bhandarkar ji was there, so I thought let me go.
now, ma'am, it's time for vote of thanks.
So you want me to do it, or I had actually?
Yes,
All
ma'am.
right.
Yes, ma'am. It's
Thank
a
you so much. Thank you so much. So good afternoon once again, and I'm really always we feel blessed when we have Professor Dr. Deepa Sikankot ma'am here with us. She's so immensely busy, and she's got such wonderful projects at hand. But ma'am, आप कभी मना नहीं करते हैं. You are always there with us, and in fact, ma'am is not just a lifetime member. She's also our board of mentors. I must say that. Ma'am, thank you so much. Firstly, we understand from all your commitments, you have a special care for us, and you come here, and your deliberation this morning, your views have been wonderful, well taken, and I think all the participants must have thoroughly understood that how inclusion really what it is and how it comes in. And if the example also that you picked up, what happened a little bit from as a team here, the glitch. So the inclusivity factor, you so well explained that, and we are really hopeful that you keep guiding us and you keep being a part of the Council for Teachers Professional Development as a mentor, and we look forward to really take a lot of programs forward. So thank you, ma'am. Thank you so much. And Dr. Sunita, ma'am, our association has been, she's one of the pioneers, and I remember that our meeting was in some other different setting years back, where we were evolving a mechanism for inclusion. And ma'am was one of the core resource persons, the nodal persons, if I would say, who was leading this project. And I happened to first time meet her and hear her and know her contributions. And since then, it's been a wonderful association. Thank you, Sunita ma'am, for being here. I missed hearing your address, but I have heard your address many times, so I know it must have been very, very good because you're working on ground, and it is commendable work. So thank you, ma'am, for being here with us.
Thank you so much, Tanya
Thank
ma'am.
you so much. To all our paper presenters, we had a diverse group. We had scholars like Parvesh, and we had students from BA Honors Psychology. We had students from BEd. We had some professors coming in. So the attempt has been good, especially commendable for the students who have come up to make presentations, because this is the research orientation has to start much early. So very good that you could do this. Thank you so much. And all the other participants also who have been so kind enough to join this track. I would like to thank my moderator for the day, Dr. Shweta Tyagi ji. Thank you. Without you, this session could not have really proceeded. So thank you for your entire presence and the way you conducted the session. And at the backbone, the session is being run by Rachna ji, Dr. Rachna. She's a very dear friend, and she's the co-convener. And Dr. Parvesh Lata ji, she's also the co-convener. We are crisis managers. We had one difficulty, so she ran to track 2.5. So she's managing the session there, but nevertheless, she has been there to plan. I thank both my co-conveners, and there are a lot of other chairs and co-chairs also here. Our members, Dr. Satyendra ji is here, and I see Dr. Sandhya ji also here. And please forgive me if Dr. Megha Gokhe ji is also here, who's one of the organizing partners. She's principal. Thank you so much, everyone. It's been wonderful and great. Masuda is also here. Thank you for joining, Masuda. Thank you so much, ma'am, for being here, and it's been a learning. Thank you.
Thank you, ma'am.
So,
Ladies,
yeah. Yeah,
Ma'am, are my
continue, ma'am.
slides
Can I have
are
your slide? Yeah, can I have your slide? I think the other slides are done. We didn't have your slide, I think. Shweta ji. All right, so I take the privilege to thank our moderator, uh, Dr. Shweta Tyagiji. This is a small token of memento from the
thank you so
Council
much.
for Teachers Professional Development. So thank you for your remarkable contribution in this track and to the overall conference. Please accept this from our side.
Thank you
Thank
so
you.
much.
So we'll share the
And
feedback.
yes.
Yeah.
So, ladies and gentlemen, as we prepare to draw the curtains on this enlightening technical session at CTPDcon Era 2024, it's my pleasure to invite as a distinguished individual among us to express our collective gratitude and appreciation for the valuable insights we are gained today with the help of the convener and co-conveners also, ma'am. Ma'am, we would be honored if you could deliver the very wonderful vote of thanks and express of gratitude to the speakers and participants and summarize the essence of this session. Now, we now to ensure that we continue to improve and meet your expectations, we kindly ask you to take a few moments to fill out a feedback form. Your insights and suggestions are incredibly important for us and will help shape future sessions. Thank you for attending our recent technical session. We hope you found the information valuable and the experience engaging. So, at the and with that, we conclude this remarkable technical session. Knowledge is a journey, not a destination. And each step brings us closer to new horizons. Thank you for your active participations and unwavering enthusiasm. Enjoy the rest of the session at CTPDcon Era 2024 and may your pursuit of knowledge continue to shine bright. Thank you so much, everyone.
Thank you so much. Thank you, ma'am. One little announcement. I forgot to actually invite from the forum Professor Dr. Deepa ma'am. Ma'am, you're cordially invited to please join us for the valedictory, and also Dr. Sunita ji, you're also cordially invited. And to all the people here, please join us at 3 p.m. for the valedictory session. Ma'am, you can continue. I forgot that.
Ma'am, we are free by 3 p.m.
No, we start at 3 p.m. The valedictory. It is from 3 to 6 p.m.
All right, ma'am. Now we are free, right? We can leave, ma'am. Thank you, ma'am.
Yes. So thank you, everyone. We will meet at 3 p.m. in validatory session again. Thank you so much, everyone.
Thanks a lot, ma'am. Thank you, Tanya ma'am, Shweta ma'am, and Sunita ma'am.
Thank you. Please fill the feedback. Ma'am, we can stop recording.